Whenever you're ready.
All right, perfect. So thank you everyone for joining. I hope you're all well and enjoying the first day of summer. I know the East Coast is seeing some gorgeous weather today, and I hope that all of you are too. Today is National Indigenous Peoples Day, and this is a day to celebrate and honor the history, heritage, and diversity of First Nations, Inuit, and Métis peoples. So to start off the webinar, it is only fitting that I begin with a territorial acknowledgement. While we are a national organization, the Mental Health Research Canada headquarters and many of my colleagues are located on the traditional territory of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. I am presenting from Halifax, Nova Scotia, located in Mi'kma'ki, the ancestral lands of the Mi'kmaq people. So for those of you who are not familiar with MHRC, sorry, just fix my tech for a sec. We are a national charitable organization dedicated to improving the lives of Canadians by advancing mental health knowledge. So we believe that enhancements in mental health service should be evidence-based, and we continue to make contributions to mental health landscape across Canada. One way that we do this is through our national polling initiative titled Understanding the Mental Health of Canadians Throughout COVID-19 and Beyond. What's special about this work is that our research is very timely as a current gauge of the mental health of Canadians. We ensure this by doing quarterly data collections that are largely stakeholder driven, and we also pride ourselves in having the largest COVID-19 mental health data set in the country. And what's more is we make it freely available to researchers, governments, and nonprofits. For those who don't have the resources to analyze complex data, we also provide frequent specialized reports and a data hub on our website. I am thrilled to be joined today by my colleague, Michael Cooper, who is the Vice President of Mental Health Research Canada, Leslie Martin, Senior Vice President of Polaris Strategic Insights, with whom we partner on this project, and a very special guest, Sarah Kennell, National Director of Public Policy at the Canadian Mental Health Association. So for this webinar, we are going to start with Sarah telling us a bit about the work that CMHA does, followed by some insights on some social determinants of mental health. We'll follow this with an update from our 16th poll of the previously mentioned polling initiative. There will be a question period following this, so please feel free to use the Q&A or chat functions throughout, and we'll get to as many questions as possible. I know there are a lot of you here and we want to hear everything that you have to say. So also please feel free, if you think of something after the webinar, to reach out to me at any point, and I'd be happy to get back to you as soon as possible. So another note is my colleague Jolene will be posting a link to a survey about this webinar in the chat. If you could take the time to fill it out, it would be really helpful to us in planning future webinars. So one more thing before we begin. I wanted to note that we will be discussing mental health indicators broadly, but at times we will be referencing topics that can be difficult for some. So recognizing that our audience today is quite varied with a range of experiences, I wanted to preemptively note that there will be mention of suicide, suicide ideation, and drug and alcohol dependency. So if anyone feels that stepping away would be in the best interest of their mental health, please feel free to do so. So without further ado, I give the floor to Sarah.
Thank you so much, Brittany. Merci beaucoup. It's such a pleasure to have been invited to this webinar. I'm really excited to be joined with you all online. As Brittany said, I'm Sarah Kennell, the National Director of Public Policy with the National Office of the Canadian Mental Health Association, and I'm joining from the unceded and unsurrendered territory of the Algonquin Anishinaabe people. And today is a beautiful day in Ottawa, and I'm really excited to go enjoy the nature and celebrate the summer solstice, including at an Indigenous festival this coming weekend. So I think it's really important for us to take a moment, especially during the month of June, to celebrate the diverse cultures and heritages of Indigenous people across Turtle Island. So what a day to be having this webinar, particularly to be talking about the social determinants of health and how they impact mental health and substance use health. So just a little bit about the Canadian Mental Health Association. We are a federation that's over 100 years old, and we've been delivering frontline mental health and substance use health care across the country for over 100 years. We really are rooted in community-based community-based mental health and the view that it's important and critical for people to not only have access to mental health and substance use healthcare supports within the traditional healthcare system, whether through a hospital or a family physician's office setting, but also in the communities in which we live. And for us, that means ensuring that people have access to the mental health promotion and mental illness prevention supports they need to prevent the onset of illness through social and emotional learning and mental health literacy. And also, the social supports that help keep people well, whether that's housing supports, income supports, food security, employment supports, and all the way through that continuum of care into the recovery phase, where we support people along their long-term journey and path towards recovery, living with a mental illness that may be serious and persistent. We know, unfortunately, that community-based care is severely under-resourced in Canada, and therefore are advocating across the country really to see an increase in resource to community-based mental health supports and mental illness prevention in particular. And alongside that, access to the social determinants that we'll be speaking to today. So I'll plop my email into the chat if anyone wants to reach out following this webinar, but I think we can get started, Brittany.
Great, thank you so much for that, Sarah. So yeah, just diving right into the questions. Our data shows that levels of anxiety and depression have not returned to pre-pandemic levels, and that those who are continuing to struggle with their mental health are experiencing even further heightened distress. So in fact, no improvements have been noted since July of 2022. We were hopeful that this flatline was due to seasonal factors, but as we sit here on the first day of summer, we can see that that has not been the case. So can you share any thoughts on why we're seeing a flatline in improvements to mental health indicators?
Yeah, absolutely. So it's really important that we examine why we're seeing this possible correlation. And for me, it's important to start with recognizing that while many of us want to and certainly are living in a post-pandemic world, the lingering effects that we experienced during that crisis time remain very present today for many of us. So when we think of the job losses that many experience, particularly among those who are self-employed, looking at the most recent employment indicators for the month of June, young people were the most impacted by that rise in job loss that we were seeing, coupled with the loss of economic support. So while CERB hasn't been on the table for now a couple of months, we certainly are seeing lingering economic impacts associated with that decrease in economic support that 8.5 million people in Canada received throughout the heaviest moments of the pandemic. And we know that 52% of CERB claimants were young people between the ages of 15 to 24. That's a staggering amount of young people who would receive that critical support during a critical moment in time. We also want to look at the fact that young people, particularly those of school-aged young people, are experiencing the lingering effects of virtual school and the return to classroom and the return to in-person education. And we don't want to underestimate the lasting impacts that remote learning has had on this particular demographic. Looking at even younger children throughout the course of the winter months in 2022, 2023, there's been a surge in childhood illnesses, including flu-like viruses, RSV, and high rates of hospitalization that we haven't seen or hadn't seen during the pandemic and even prior to that. Related to the healthcare sector, we're also seeing the mass exodus of healthcare workers from the sector because of high rates of burnout. So these are just some of the examples of how really we're living the very lasting impacts of the pandemic and how that might be contributing to day-to-day stress, anxiety, and depression at a population level. And the last thing I'll say is that there's also research that demonstrates a very strong correlation between inflation and economic insecurity and stress. So as we know, inflation hit a high a 40-year high last year, and that there's a link between inflation and then food insecurity, housing precarity, rising household debt, inability to pay bills, and with that comes psychological distress. And so, we need to examine the very strong correlation between the economic insecurity that we are experiencing and our ability to cope and the stress that comes with that. And finally, I would just mention that we know through this research and other research that's been undertaken in decades past that economic insecurity is not felt equally among populations. So those who have pre-existing insecurities and vulnerabilities related to socioeconomic status are at higher risk of experiencing the negative effects of inflation, and therefore higher risk of experiencing psychological distress.
Thank you, Sarah. Moving on to the next question. So a recent MHRC report has revealed that compared to the Canadian average, equity-seeking groups, including 2S LGBTQIA+ folks and racialized groups, are struggling disproportionately with mental health challenges. So we know that mental health in Canada is a mosaic of lived experiences influenced by a unique combination of individual, environmental, and societal factors. So are you able to explain more about these unique factors that might be contributing to elevated levels of anxiety and depression, or on a very broad level, the link between systematic or societal factors and mental health?
Yeah, so first, I think it's important to look at what we mean by the social determinants of health. So the World Health Organization defines the social determinants of health as the prerequisites or the circumstances through which people are born, they develop, live, and age. And they contribute to not only good health, but also quality of life. And in practice, in practical terms, what that means is, our access to education, to healthcare, to housing, to a safe environment, to environments that are free of stigma and discrimination, free of negative childhood or adverse experiences in childhood, opportunities for social connection and belonging. So all of these, together build out what we call the social determinants of health. And we know that they're critically important when it comes to ensuring we have good mental health. And in fact, we know that the social determinants contribute approximately 50% of health outcomes, as opposed to clinical services, which contribute to about 20% of health outcomes. So it's really important for decision makers and healthcare providers and advocates to take stock of the critical importance of the social determinants when it comes to advancing good health and good mental health. Conversely, we know that when we don't have access to the social determinants of health, that we see health inequities arise. So, whether it's lower life expectancy, poor health outcomes, a higher burden of illness, particularly those within equity-seeking groups. These are, of serious concern. When it comes to looking at across the lifespan, individuals can experience kind of multiple and overlapping or intersecting forms of inequity and access to those social determinants of health that can further put into question their ability to experience positive health outcomes and quality of life. And they can also span across generations. So when we think of intergenerational trauma in relation to poor health outcomes, this is very much a reality for many folks. When we don't have access to the social determinants of health, we also know the research tells us that it's a contributor to stress. And so when we lack economic security, for example, it can cause increased stress, which triggers a physical reaction in our bodies, and it can inform how we act and behave in relation to our communities, and really change how our motivation and our thinking influences our behavior, and can cause psychological changes that influence physical health, including on heart rate and blood pressure. So there's a very clear relationship between access to the social determinants and the physical symptoms that are caused by the psychological distress experienced. Just talking about a few specific examples, when we think of poverty in relation to mental health, of course, rates of anxiety and depression increase or can be increased when we see when we look at lower income groups. Research shows that depressed mood and anxiety are 2.5 times higher among youth aged 10 to 15 who are low income versus their peers who are higher income. So the research is quite clear there. Similarly, when we look at discrimination as it relates to racism in the healthcare sector, so because of the historical legacy of colonialism and the ongoing impacts of racism in our communities, whether it be, racial profiling by law enforcement professionals or the ways in which racialized folks access healthcare and through the colonial lens of racism for Indigenous folks in particular, all of these factors contribute to poor health outcomes, specifically among those populations, and can lead to increased trauma within the healthcare setting and a reluctance to seek healthcare in the future. Similarly, when we think of discrimination on the basis of sexual orientation and gender identity, to us LGBTQ2 plus folks are at a higher risk of experiencing depression, suicidal ideation, anxiety, and problematic substance use compared to cisgender heterosexual folks. And that's because of, as we're seeing very recently and across the country, in part the rising hate and violence that is facing those communities. So, at the end of the day, we need to consider social location and identities in an intersecting way, and how they relate to the social determinants and how that impacts upon health outcomes.
Thank you, Sarah. And I see Michael has a question that he'd like to.
Yeah, hi, Sarah. Always good to chat with you. I'm going to go off script and ask you a question based on one of the comments you made. I did hear you speak about stressors, managing stress, and then move into a conversation around anxiety and depression, which are independent constructs from one another. And I'm cognizant that there are many different varieties of individuals who are participating on this call who may not necessarily, I heard you make the distinction correctly. But I wanted to just highlight that and ask a question following that. So to me, there is a degree of which stress is, and your response to stress is a normal response. If you are put into a difficult environmental stressor and you show stress, that is a reasonable response to that. From where I'm sitting, there are also considerations of what is an abnormal response to stress. At what point does stress become a trigger for an underlying mental health issue? And drawing the distinctions between neurologically driven and environmentally driven, of which there are both factors are driving into, anxiety disorders, depressive disorders. We know there are some people who are at risk with environmental stressors, some people who don't need those sort of environmental stressors. I just think I'd like to draw a cleaner delineation here from that, because you covered both in that commentary, and I just was hoping you might be able to respond to that.
Sure. Yeah. So, as you said, it is normal to experience, mild symptoms of stress and anxiety too. And those things are part of the range of emotions that we experience that are healthy within the human experience. And it's important, I think, to make the distinction when it comes to our ability to cope with those emotions when they become moderate to severe. And that's when we either through a period of prolonged stress or extreme stress caused by potentially external environmental factors, intergenerational trauma, all of these things could be impacted by one another. The causes can be diverse, of course, but the ability for us to cope is determined by our resiliency, and that resiliency is impacted by our environmental realities. So the extent to which we do have secure housing, predictable and secure income, we live in a stigma-free environment. We are free from discrimination. We feel social connection. We don't experience loneliness. Like, these things create a stable environment in which we can build our resiliency and kind of charge our battery that allows us to cope with the day-to-day stresses that we would experience in a normal level. When it transitions into more significant or more moderate to severe experiences of stress, then we start to see signs of interruption around day-to-day activities that really prevent us from living life to the fullest and kind of completing daily functions, those types of things that start to interrupt our day-to-day life.
Thank you for that impromptu response. That was fantastic. Thank you. You were speaking about access to care a little earlier, so I wanted to move on to that. And over the last year, 1 in 10 Canadians have reported accessing mental health and substance use supports. This number has remained relatively stable since July of 2022. So can you talk a little bit about the role of social determinants of health that they play in access to care?
Yeah, absolutely. So socioeconomic status is one of the biggest predictors in terms of access to mental health supports. And we know that there is a correlation between increased income and the ability to not only access the social determinants, whether it be, housing, education, employment, those types of things, but also our access to healthcare, and therefore, are more likely to experience more positive health outcomes. So some specific ways in which we see the relationships to the social determinants impact our access to mental health and substance use health supports. I'll give a few examples. So as I mentioned, income is a huge determinant in that we know many mental health and substance use health services are privately available. So that means you either have to rely on private insurance benefits that are employer paid and employee contributed to, or pay out of pocket to get those types of services. So that's a huge barrier. There's also the cost of medication. Many folks have to pay out of pocket in the absence of national universal pharmacare. So income and financial security is a huge barrier when it comes to accessing care. Another is geographic location and connectedness. So when we think of access to care outside of major urban centers and the erasure of access to public transit and regional bus service, this is a huge determinant when it comes to having to travel outside of community to access the care that you need. There's also telecommunication, access to high-speed internet in a world where we're transitioning to virtual care, and the privilege that comes with accessing those types of resources. We've talked a little bit about stigma, but stigma is incredibly prevalent, particularly among those who experience multiple and intersecting forms of oppression. So folks who are housing insecure, who enter a healthcare clinic, are at higher risk of experiencing discrimination at the hands of healthcare providers who may hold preconceived negative views about their history, their background, their experience, and what they might be presenting with, which ultimately deters them from seeking care in the future, which contributes to a cycle of further marginalization. And then finally, as I mentioned previously, racism and the extent to which racist practices continue to imbue our healthcare system are incredibly dangerous. There are real experiences of distrust among racialized communities and Indigenous communities in accessing healthcare because of past negative experiences and sometimes even traumatic experience that they've traumatic incidents that they've experienced in healthcare settings, which really speaks to the lack of access to culturally appropriate, culturally safe care, and a real shortage of racialized and Indigenous healthcare providers within the healthcare system, which, you know, harps back to you know, the racist and colonial roots of our healthcare system.
So on that note, what role would you say that community healthcare plays just overall to try to fill some of these gaps, I suppose, that exist?
Yeah, I think community-based care plays a really critical role. First and foremost, community views the whole person. So it really centers on seeing the person not only for the mental health concerns or the mental illness that they may present with, but also that person's you know, social environment in which they live. And so community-based care really extends beyond the clinical services that we think of in terms of access to counseling or psychotherapy, substance use health treatments, eating disorder treatments, to really wrap around support where we ensure that our clients and members access the full care that they need to be well in their communities. So that could include assistance with applying for a job, or you know, education or retraining supports, or you know, having access to a food pantry when they need, you know, accessing an affordable housing unit. So these things are part of what makes community so critically important, because we're really ensuring that that person not only has their mental health or substance use health needs met, but everything that wraps around that person. So it's really seeing that whole person from beginning to end. The other piece is around mental health promotion and mental illness prevention. These are services that typically fall outside the traditional healthcare system. So when we think of social and emotional learning, so equipping young people with the skills to be able to identify emotion and what they are and how to deal with them, mental health literacy for the general population, when we think about reducing stigma and discrimination against people living with a severe and persistent mental illness, being able to identify and use the appropriate language, and also offer appropriate supports, and that doesn't other those folks. You know, the other piece is around peer support. Community-based providers employ peers who have lived experience, whether it's with a mental health concern or mental illness or a substance use health concern. And those people themselves, you know what it's like to have walked in other people's shoes, and can provide that support and guidance. And it's non-judgmental, and it's really guided by the needs and interests of the individual that's seeking care. So peer support is a really incredible service offering available in community. And then the final piece is really around the advocacy piece. We advocate not only on behalf of the people that we serve to ensure that we're building a mental health and substance use health system that serves them the best way possible, but also themselves and their communities, and how they can get the care that they need from the service providers that they may be interacting with. So playing that advocacy role from an empowering and self-determination perspective is really, really important and core to what community-based organizations do.
Great. Thank you so much, Sarah. I'm getting the 2-minute prompt from our comms director. So I wanted to ask one final question before I just leave it open to you to see if there's anything else you'd like to add. And this is kind of going in a different direction, but more recently, Canada has been affected by an ongoing series of wildfires in Ontario, Quebec, and Nova Scotia. So do we see any evidence of these more extreme weather events or increasing environmental concerns are impacting the mental health of Canadians?
Yeah, you know, it's a rising concern for the Canadian Mental Health Association. We know anecdotally, we've seen an uptick in demand for service, particularly for folks who are experiencing climate disasters in their communities and not knowing where to go to kind of respond to the needs that or the concerns that they're presenting with that are stemming from experiencing the loss of housing, displacement, and the other mental mental health concerns that emerge because of climate change and environmental degradation. We have very little research in Canada that demonstrates, you know, the impact of climate disasters on mental health. There is some research that emerged out of Alberta following the wildfires in 2016, which looked at young people's, teenagers in particular, mental health following the wildfires. And that research showed us that those young people were more likely to experience and be diagnosed with PTSD, depression, and anxiety. And that would also kind of, you know, demonstrate to us that this increased demand in service that we are facing from the Canadian Mental Health Association is very significant and worrisome. The reality is that we are more likely to experience climate-related disasters in the years to come with the rising temperatures that we're seeing. I think this spring is very evident of that. And so it really begs the question, is our mental health system equipped to deal with this rising demand that now through this polling research that you're about to present on, I think also demonstrates that sustained and prolonged increased experience of stress, anxiety, and depression within the general population. So these are things we should be incredibly concerned about, and one that we should be looking at young people in particular who are at increased risk of experiencing what's known as eco-anxiety. And that's something that we're seeing internationally as well.
Great, thank you. And is there anything else you'd like to add before we jump into the Poll 16 findings?
No, I think, you know, for us at the Canadian Mental Health Association, we really want to make sure we're not separating conversations around access to mental health care and substance use healthcare from the social determinants. If we think about mental health systems change writ large and access to the type of care that we want to see across all populations, but particularly those who are at increased risk of experiencing a mental health concern, as evidenced by this polling research, we really need to be focusing on what care looks like beyond the clinical services that may or may not be available to us. And that means access to housing supports, income supports, food security, and environments that are free of stigma and discrimination. So I really welcome further conversation about this and look forward to hearing more about the results of the polling.
Wonderful. Thank you so much. So we're going to quickly scoot over to the Poll 16 findings. There will be a question period at the end, so we can cover everything that you'd like to know. So please keep any questions for Sarah top of mind, as we will have time for them. So a Poll 16 update, just a few notes about our polling initiative and this report before we get started. This report is a very small sample of the data that we collect in each poll. We currently have a data set of approximately 55,000 respondents, of whom we ask a host of questions about demographics, mental health diagnoses, factors of mental health, and access to care. And while about 70% of the questions remain from poll to poll, the other 30% change quite frequently through collaboration with stakeholders. So this massive data set, as I mentioned, is freely available for the purpose of advancing mental health knowledge and research. And we currently have over 50 individuals and organizations as data sharing partners. So I say again, if you're interested in this data set, please feel free to reach out to me for more information about how to get access. It is really quite simple. So another thing, this data reflects, actually, Michael, could you move on to the methodology page? Thank you. So this data reflects responses received in May of this year, and we will be polling Canadians again in late July or early August. So Michael, Leslie, Sarah, please jump in if you have anything to add throughout this. I'm going to be kind of flying through, so don't feel like you can't interrupt me. If you have any questions, please make use of the chat function as mentioned. If a question comes to you after, please feel free to contact me. Also, I want to make sure that you're aware that these reports are available in both full and abridged versions, on our website for future reference. So with that, we're going to move on to our major findings. Next slide, please, Michael.
Sorry, I'm trying to also keep up with the chat.
That's okay. The results of neither self-rated mental health nor clinical screeners have improved since July of 2022, as I mentioned. So this is following a continuous and steady improvement from the peak of the COVID-19 pandemic. And as I mentioned, previous years have demonstrated a bit of positive change as the weather began to turn and the days lengthened, but this has not shown to be the case this year. And as Sarah indicated, we continue to see that certain groups are more likely to experience mental health challenges than other groups, including younger Canadians, 2S LGBTQIA+ communities, racialized groups, and those experiencing financial challenges. And to expand on that, in the second finding, inflation is affecting half of Canadians through a negative impact on their mental health. Direct results of inflations are that 35% have cut spendings on essentials, 1/3 have had to use their savings, 1/5 have gone into debt. 35% of Canadians are currently experiencing some level of food insecurity, whether they have concern over being able to sufficiently feed themselves and their families, or are already relying on food programs. We found a correlation between Canadians who are experiencing food insecurity or have gone into debt and high levels of anxiety and depression. Sarah, Leslie, or Michael, do you have any input here? Or would you like me to move on?
I think this is pretty self-explanatory to me, but I'm more than happy to. Yep.
Sure, I'll keep going. So burnout is an area that has come into light in recent years. Our data shows that 1/3 of working age Canadians report experiencing burnout. And while this has many negative side effects, one that we're currently looking closely at is a strong correlation between Canadians experiencing high levels of burnout and those demonstrating possible dependency on alcohol and cannabis. So nearly half of Canadians who demonstrate possibly dependent use say that they are burnt out most or all of the time. Alcohol and cannabis use are tracked through the audit and credit our screeners, as you're going to see a little bit further on. Despite this, we continue to find that Canadians are resilient. A newer question we've asked respondents shows that most Canadians are feeling happy and interested in life. And this has a strong correlation to age, with those 55 and up most likely to say so. But to turn back to a troubling finding, those with high levels of anxiety and depression on a self-reported scale are more likely to feel unhappy and also to experience suicide ideation. So we'll touch more on suicide ideation a little bit later on, but one thing that we found particularly troubling in this analysis was that 4% of men indicated having made a plan to die by suicide this past year. Our final major finding for this collection is that most Canadians say that they feel confident in knowing where to access mental health support. This is despite it remaining a primary barrier for those who feel like they need to access support but haven't done so. So in Poll 17, we are going to dive deeper into this to find out where Canadians would first turn to support if they felt like they needed it. And that brings us to the end of our major findings. If anyone would like to add anything, please feel free.
Brittany, can I just make two reactions? One is someone in the chat mentioned access to primary healthcare providers. And I think this last point around not knowing where to get help as a primary barrier is an interesting one, because I think we have to take it in the context of many folks in Canada not having access to a primary healthcare provider who they can, rely on and visit regularly, depending on what their needs are. And related to that is also the fact that, many who are experiencing a mental health concern for the first time, the logical entry point into the healthcare system is through their family provider. And even if they are accessing it, we know that family healthcare providers lack the resources, the time, and sometimes the specialized training to be able to respond effectively to provide the care that's needed. So just to say that, access to healthcare being a social determinant within the context of access to mental health services is really important. And then the suicidal ideation piece is also relevant, given that this month is Men's Mental Health Month. So wanting to make a plug for increased awareness around the increased prevalence of suicide among men, and to just draw attention to that really staggering statistic. Thank you.
Absolutely.
Can I riff off that? Couple things to clarify as well too. So I'm assuming it's on later on, but we have found about 11-12% of Canadians are indicating their access in some sort of mental health support. and about 35% of those are indicating they're accessing it through a publicly funded healthcare. So, and of those individuals, so 12% of the 12%, 35% of, so was about 4% overall, are accessing through public health. And then of those individuals, at 4%, about 70% of the people who are accessing through public health are doing so through a family doctor. So we do have a bit of a context of how important the family doctor is as part of that ecosystem. It is the primary mode of which individuals who are accessing through publicly funded healthcare are accessing mental health. And there are lots of studies to show what percentage of physicians, family physicians, feel competent in addressing mental health issues. There's also lots of data to show that system navigation continues to be a problem because of the complexity of that, and where do you send people. Lots of great information and data on that front. The other one I wanted to comment on was your men's mental health comment. And I think one of the things that struck me like 2 years ago, like we've been following this for a long time, and I know Leslie and I, we talked about this too, which is the Kessler psychological distress scale, which looks as a general distress. And what you find is women are reporting higher levels of moderate to severe than men comparatively. And then once you get to that most severe category of psychological distress, the numbers of men spike, which also shows to me, and at least my interpretation of this, is that men are not reporting mental health issues until they're in the most severe category. And so there's like women, there's a gradual increase. Men, it's like flat spike, you know? And so I think that has to do with the way that we're still talking about stigmatizing mental health to a large degree, but we can validate that with data. So just a few thoughts I wanted to throw in.
Thank you, Michael. Leslie, I saw that you mute has turned off as well. Did you have something you'd like to add?
Yeah, I just wanted to talk about the primary healthcare providers, and we've done qualitative work. So I have talked to a lot of people about how they're accessing mental health care and supports, and it is true. Like they don't know, and there's so many people that understand that there's other supports out there, but when they're in a crisis, they can't look for it. They don't have the capacity to find it other than going to their doctor. So it becomes very difficult, and especially when you're looking at some of the, like the LGBTQ2S+ community, and if they don't feel comfortable talking about this with their doctor, that just adds another level. So it is really important to have that primary healthcare physician, primary healthcare person to be able to talk to, because it's the only place a lot of people can think to go.
Absolutely. And that qualitative report that Leslie mentioned is available on our website and has some very interesting and important insights. So please feel free to check that out if you'd like some more insights on that. In the meantime, let's move on to some more detailed findings of our report. So 1/10 of Canadians say they are experiencing high levels of anxiety. This has remained consistent since July of 2022, as I've mentioned many times. It also continues to be higher than before the onset of COVID-19. A similar percentage of Canadians say they're experiencing high levels of depression. So this has also remained consistent since July 2022 and is also higher than before COVID-19. So as compared to all other respondents, Canadians I should note before I say this, that our data collections, we poll 16 years old and up. So when I say younger respondents, I'm not referring to anybody under the age of 16, because we simply don't have that data available to us through our collection methods. But at younger Canadians between 18 to 34, students, those who are unemployed or experiencing financial troubles, to us LGBTQIA+ identifying respondents and racialized groups tend to experience high levels of anxiety and depression. So on to the next slide. This is just a different look at this flat line. So you can see there's only been marginal change since poll 13, which, as I mentioned, again, was July of 2022. On to the next slide. We use multiple clinical screeners in our data collections. It is important to note that these are not diagnostic tools, but rather screening tests, which help determine the severity of symptoms. So here we have the general anxiety disorder, or GAD-7, which shows that 5% of Canadians are showing symptoms of severe anxiety and 10% are showing symptoms of moderate anxiety. So these scores have remained consistent since we implemented this test in poll 6, which was in April of 2021. Here is a timeline of the GAD-7 scores, April 2021. So as you can see, there's been very little change across the board. On to the next slide. The Patient Health Questionnaire, also known as a PHQ-9 test, is another clinical screener to look at the severity of symptoms of depression. So this demonstrates that 23% of Canadians are likely to have symptoms of moderate to severe depression, with 4% having severe, 7% having moderately severe, and 11% having moderate symptoms. So again, symptoms of moderate to severe depression are showing to be highest among 18 to 34-year-olds, those who are unemployed or experiencing financial challenges, or those who demonstrate signs of alcohol or cannabis dependency. So yes, we are here. So you can see here that these results have also remained consistent since we implemented the test in April 2021. So on to the next one. As we've heard, understanding the social determinants of mental health is an important factor in making mental health care accessible for all Canadians. Two areas that we've been tracking are housing insecurity and food insecurity. The sample of Canadians who report experiencing major housing insecurity is still at this point too small for us to do any deeper analyses, but we will continue to track this and eventually be able to look at specific mental health indicators. But we do know that 35% of Canadians are experiencing food insecurity, whether it be through concern about providing healthy options or those who are already relying on food programs. So unsurprisingly, we've found correlations between Canadians experiencing high levels of anxiety or depression and those experiencing. On to the next slide. And I would like to note for a demographic breakdown of those likely to experience food insecurity. Among other mental health indicators, you can go into our full reports on our website, and there is much more detail that you'll find there. So while previous analyses have demonstrated that inflation and the state of the economy have been having negative impacts on the mental health of Canadians, we wanted to understand the more everyday effects of inflation. So we found that 3/4 of Canadians say that inflation has impacted their financial life in the past year. More than half have reduced their spending due to inflation. 41% have reduced their discretionary spending. As I mentioned, 39% have had to cut back on essentials. 1/3 have reduced their savings, either by dipping into their savings or reducing their savings contributions. And 1/5 have increased their debt, either by relying on credit cards or borrowing money. So those who rate their anxiety and depression as very high, which is in other words, a 9 or 10 on the self-rated scale, are more likely to be experiencing debt. So younger Canadians, people with children under 9, frontline healthcare workers, racialized groups, and those with physical impairments are most likely to have taken on debt as a result of inflation based on our findings. So this table is a little bit hard on the eyes. So again, just another reminder that these reports are available on our website under the National Research and Data section. So it shows some other economic factors of negative mental health. I do want to point out that the second one, your recent job loss, was asked only of those who'd indicated recently becoming unemployed, and it is not indicating that half of Canadians have recently lost their jobs. So just wanted to make that very clear. But we can also see in this chart that the possibility of not being able to fully pay household bills is a major stressor for over 1/3 of Canadians at 37%. Let's move on. So here we're looking at the audit screener, and we can see that 5% of Canadians are showing signs of being dependent on alcohol, while 9% are exhibiting harmful behaviors. So this has remained unchanged over the last 3 polls. So about over, let me do some math in my head, just under the last year. So younger Canadians, those with children under 9 years old, those with financial troubles or are likely to have symptoms of a mental health disorder are indicating being more likely to demonstrate signs of a possible alcohol dependency. And a likelihood of dependency among frontline healthcare workers is higher than average at 14% based on our data. And moving on to the Cut It R screener. We can see through this screener that cannabis dependency seems to be less prominent than alcohol dependency, with 3% exhibiting hazardous behavior and 6% indicating a possible disordered use. So those found to be more likely to demonstrate signs of possible cannabis dependency are wide-ranging. So 18 to 34-year-olds men, those living alone or with children under 9 years old, frontline healthcare workers, those experiencing financial troubles, racialized groups, those experiencing symptoms of a mental health disorder, or experiencing high anxiety or depression is what we've found.
Can I just pop in here for a second?
Sure.
I just want to clarify two quick things on this. One is the alcohol and cannabis looks at all Canadians, and there are alternative ways of doing this analysis where you only look at people who consume alcohol or consume cannabis. And since this is 100% of the population, you might get a different result if you said, well, if only 40% of the population does cannabis, and you see there might be a higher proportion of people who do cannabis who have dependency on it, but because there may be fewer people in the general population who actually do it. So you can analyze this two different ways, just to be clear. And the other thing, and I know you mentioned this, Brittany, but I wanted to highlight it, was we have been following trends around alcohol and cannabis to a lesser degree, dependency on high burnout sectors, which is problematic for obvious reasons, because we know some of those high burnout sectors are some of the individuals we're most reliant on in our society. So very, very troubling, certainly. Sorry, just want to interrupt.
No, thank you for clarifying that. That's absolutely true. Thank you. Let's move on to the next slide. We have been tracking suicide ideation for quite some time, and this number has remained fairly consistent, with 13% of Canadians having thought of it in the past year. So certain groups show quite troubling numbers here, particularly the 1/3 of 16 to 17-year-olds who report having thought of suicide in the last year, and 33% of 2S LGBTQIA+ identifying Canadians who have as well. Among others, some particularly at-risk groups seem to be 18 to 34-year-olds, frontline healthcare workers, students, and unemployed Canadians. Reports of suicide ideation are the same among men and women at 13% for both. But however, as I said in our major findings, men report being marginally more likely to have made a plan in the past year. So moving on to the next slide. This slide is kind of a good news, bad news story. As I said, our findings largely demonstrate that Canadians are resilient. 64% of respondents say they feel hopeful about their future, at least most of the time. That said, 1 in 10 say they rarely or never feel that way. So our work continues to show us that a good support system is a major factor in positive mental health. And here we can see that 84% feel that their relationships with their friends and family are good, and 76% feel that they have people that they can count on. This chart also looks at levels of burnout, which we have touched on a couple times. So 1/4 of Canadians overall say they have felt burnout, and 1/3 of working age Canadians. So if you'd like some further insight on this, we've recently published a paper on sectors demonstrating the highest levels of burnout, which, spoiler alert, are nurses and educators. This paper was based on both quantitative
and first responders.
and first responders. Yes, this paper was based on both qualitative and quantitative findings. So on to the next slide.
Just to pop in here as well to say that we've done a lot of analysis on this question around relationships with family and friends, and this is one of the strongest. I know you said it, Brittany. I just want to reiterate this. It is one of the strongest indicators of probabilities of having a mental health diagnosis or an undiagnosed mental health condition, or high levels of anxiety and depression in terms of your relationships. Among almost all the factors we look at, this remains one of the most substantive.
Thank you. And I know I'm moving quickly through these slides. I do want to make sure we have time for questions at the end, because I know there are going to be some very good ones coming in. So moving on, as a follow-up to hopefulness and support systems, we have found that 82% of Canadians usually feel at least somewhat happy. Those over the age of 54 and retired Canadians are more likely to report being happy and interested in life than younger age groups, while those who are students or unemployed are less likely to say that they are happy. So not surprisingly, anxiety and particularly depression impact happiness. Almost half of those who rate their depression as very high, again a 9 or 10 on a self-rated scale, say that they are unhappy, with 1/5 saying that life is not worthwhile. 1/3 of those rating their anxiety as very high say that they are unhappy, with 1 in 10 saying that life is not worthwhile. On to the next slide. 1 in 10 Canadians have accessed mental health or substance use support in the past year, as I mentioned. Our full reports on our website provide a much more detailed look at what kind of support is being accessed, frequency, the length of use, and satisfaction of care. So we will soon be releasing a second report from our Poll 16 analysis looking at these details. Understanding who's accessing mental health support and how they're accessing it is important in understanding how to best support Canadians. Equally important is understanding who is not accessing care and the reasons that they're not doing so. So we can see here that 4% of Canadians have felt the need to access mental health care, but have not done so. We found the primary factors of not accessing care to be not knowing where to find support, wait times, preferring to manage yourself, and also not being able to afford care. And on to our last slide. So as I mentioned in our major findings, 2/3 of Canadians are somewhat or very confident that they would know where to get mental health support for themselves or their loved ones. Unsurprisingly, those who have accessed mental health support in the past year are more likely to feel very confident, as are those with a diagnosis. That just makes sense. From a regional standpoint, Quebec holds the highest confidence in knowing where to access mental health support. And we have made it to the end of our abridged report. And again, there are a lot more details to be found in our full report, which is posted on our website at mhrc.ca. And we have we have some time for questions now, so let's dive in.
Before we get started on questions, I've said it and I will say it again. Brittany, you are a rock star in showing that data.
Thank you.
It is an incredibly complex data set, which we have paired from like 100 potential slides down to like 15, which is a massive undertaking, and it is deeply complex, and you are a master of it. I just want to say I appreciate that.
Thank you very much.
Before we take questions, I wanted to ask if Leslie or Sarah had any comments they wanted to do, and then we'll pop into the multiple questions we're getting. No? Okay.
I haven't been doing a great job of tracking the questions throughout. I think Michael has been doing a better job than I have.
Okay, so let me just answer a couple of these very quickly off the top of my head. Yes, this is being recorded. Yes, we will send out a YouTube link to this so that individuals can watch this afterwards. So you can follow it that way. We have on our website, mhrc.ca, there's a link at the top that says our work. If you click national research, you can get our, there will be 4 drop downs after that, or 4 things on the page. One is our interactive data hub, which will allow you to play with the data itself. One is a key facts page that we use for some of our major partners to point to for just some of the most significant facts that people want. There also says our quarterly reports, our national polling reports, which is the report we do once per quarter, which this is the 16th one. And then the last one is our research brief page, which is where we dump all of the deep dives that we do. So the report on burnout would be on the research brief page, as well as another 30 reports looking at everything from the unique footprints of workplaces, composition, LGBTQ, social determinants of health. That's where we do our super deep dive work, where us data nerds get together and really just pound out huge, long, comprehensive reports on that page. And then we also have another page called our workplace mental health folder, where we publish all of our workplace mental health studies, of which I mentioned to an individual on the chat. We're publishing another major workplace mental health study on Tuesday, which is 5,500 Canadians who are employed, looking at psychosocial factors that impact workplace mental health. So that answers a ton of those questions. Yeah.
Thank you, Michael. So I know we have some more specific to mental health indicator questions in here for both our report and Sarah.
I think the one Sarah, what can you tell us about burnout? Sorry, burnout, bounce back.
Bounce back to address burnout.
Yeah, okay. Can you speak to what difference that is making and how you track the impact on that?
Yeah, certainly. So Bounce Back is a virtual CBT program that's self-directed with the support from trained coaches. It's a program that's available across the country. In terms of efficacy, we're certainly seeing increased uptick in the program, and in terms of outcomes, we rely on the data from the UK because it has been robustly evaluated in terms of its contribution to positive health outcomes. So there are significant positive results associated with the program. To my knowledge, it hasn't been robustly evaluated in Canada, given that it hasn't been available for as long, but certainly the localized research that we see demonstrates positive results. I think I'd also throw it back to you, Michael, in terms of other virtual supports like Wellness Together Canada that similarly we could draw correlations to in terms of outcomes, positive outcomes.
Yeah, so Wellness Together Canada is another great free resource for individuals. It does have a front end of resources you can access for free, and then it does have when you register a series of clinical screeners, and then does implement the step care model, trying to get you to virtual services. We do track a number of virtual services, including Bounce Back, including Mind Beacon, in which Ontario made available for a number, I believe, in another province as well. We do track Wellness Together Canada in terms of awareness. Well, some of these programs don't have fantastic awareness across the entire spectrum of Canadians. When you look at the subset of individuals who have mental health needs, as well as their caregivers, you can see a significant uptake in awareness on these programs, which is great. So I'm super excited about that. I'm just going back in the emails here, and our good friend, Michael Herman, who I will see next week, I believe, was asking about chronic stress. Does the chronic nature of stress for many, particularly if more severe, have adverse effects on mental health? Absolutely, is my answer to this question. There is obviously, the thing I want to highlight though, is that typically when we talk about anxiety and depression, we're also looking at things that are neurologically driven as well. But that doesn't mean you cannot be experiencing them. And there are significant overlaps between stress, burnout, and depression. But those are independent constructs from each other. And as far as I understand, the DSM-4 doesn't recognize burnout as a specific mental health condition. I know I've heard there's a news report coming out about this soon. But yeah, it's certainly an interesting question, and chronic stress we do see significant overlaps between individuals showing high levels on depressive and anxiety screeners and those who are showing burnout levels. We also know, for example, that there are higher levels of diagnosed individuals. I think it was like 11.4% of healthcare workers indicated a new diagnosis since COVID, and that was one of the highest burnout, highest stress sectors we had during the pandemic. So absolutely, the correlations, we can quantify those correlations, and I don't think anyone want to challenge that. I don't feel the need to.
Is that the end of the questions? Oh, you're on mute, Michael.
No, just a lot of great appreciations. I think that's all the questions. Was there anything we missed? If we missed your question, fire it to us right now and we can address it. And if you have to go, please go. We've lost about 40 people in the last 2 minutes, so I'm sure most people are going.
We are notorious for going a few minutes over in these webinars, so I appreciate everybody taking the time to share their afternoon with us. Sarah or Leslie, is there anything that you'd like to add before kind of our sign-off words?
No, thanks for having me. Great discussion.
Yeah, thank you very much. And Sarah, thank you, because I really enjoyed listening to what you had to say about that.
Thank you both so much for coming and for your incredible contributions to this conversation. And thank you everyone for joining who's still here. Please be sure to follow us on social media or to sign up for our mailing list on our website for more information on future events and announcements. And one more time, if you have any questions that weren't addressed here, or if you'd like to know more about our reports or our data or anything MHRC related, please feel free to reach out.
I'll hang around for one more minute just in case there's any questions.
I have to bump off, but it was so lovely. Thanks so much.
Thank you so much, Sarah.
Okay,
Sarah.
talk soon. Bye.
It's great. I think we got to all the questions. I don't see any more. This is fantastic.
Yeah.
I always feel we leave with unanswered questions. I always feel guilty about that. So, all right. I think we'll stop recording. Thanks.